Just to make a brief introduction.
My name is Mартіном Ветзелем. I'm a general practitioner in Germany. I'm very satisfied with my profession. We provide care for about 2,000 patients. We are living here in a rural area in the countryside, which is not very interesting. It's completely different to the city.
It's actually mountains, not just
mountain,
rural.
It's countryside, it's farming. It's a lot of wood. Usually people spend their holidays in our area. We have a few industry and a lot of agriculture work. The young people leave the countryside to work in the cities. And we are, as doctors, we are settled in our city. And we have about 70 physicians who are practicing in their own practices. About 45 are general practitioners like I am, and the rest is specialists. So that when I started, I was responsible to provide healthcare for my patients from Monday 7 p.m. to Monday 6:59 p.m. So it's a whole week on call.
No holidays?
No holidays, nothing like that. And if I want to get off and have some holidays, I have to ask another colleague if he would take over for a week or 10 days or something like that. So myself, I thought it's stupid that 3 doctors sitting around and not knowing about what they do. So the idea came up to say, let's work together. And that's what finally was the start of becoming a network of the physicians. We started in Hornberg, where I live and where my practice is, to say, okay, let's have the Wednesday afternoon off, let's have the weekends off, and we take over and we change with the responsibilities who is on service and who is on call for the weekend. One is doing the service and 2 are off. And this was no bad idea. Aside that, the political system, the social system in Germany changed, because that might be the same at your place. It depends on the money. The costs are increasing, and the income for the health insurance companies was decreasing out of political reasons. And doctors were not satisfied with the situation around the work. We had a lot of administration, a lot of bureaucracy, and we had to do a lot of things off the medicine, which we didn't see any sense. We had to work more. The wages were decreasing for us, and so nobody was really enjoyed about the situation. And that's when we started up to say, let's change something, because we knew that the basic situation of providing healthcare is not the hospital, it's the general practitioner in the countryside. We have to face about 90% of the patients see the GP first in this area. In the city, it's different. But in this area, the people went to the GP when they have a health problem. And we are able to solve most of the problems.
What percentages?
I would say 80% we can solve in our practices.
Okay.
Or we can solve in the ambulant medicine. And the hospital is left for those cases who really need hospital care. Well, and that was the idea to come together, to come closer together again as doctors. We knew the colleagues when we had training sessions or some kind. I knew about the name of the colleagues here in Гаузах, or they knew who was Mартіном Ветзелем, but I didn't really know them. So, and we said, we took the chance and invited all of those doctors and said, okay, how can we make the situations for us better? Saving time, getting more money, which is very egoistic, but it's a true statement, and in the end, providing better medical health care for our patients.
Because it is connected.
Pardon?
Because it is connected.
Because it's connected. So when these meetings first were very informal, everybody could join, and out of this, about 2-3 years later, we realized that there was some power, because a group of 50 people could reach more, could achieve more in the end than as only one. And we formed the Medical Quality Network in Kінzigtаль, which now today is the oldest one in Germany that survived.
And makes how many people?
We invited all the physicians of Kінzigtálь, it's been about 70. In the end, half of them, 35, formed the medical network in 1992. And they are still part of the network until today. And that was the situation to talk about medical standards, to talk about how we do diagnosis, how we do therapy, how we provide our patients with all what was necessary, because there is a big difference what the health insurance pays and what really is necessary. In Germany, we have everybody has the right to enter the medical system as when he thinks he needs it. But the definition of healthcare in Germany is ausreichend, zweckmäßig und wirtschaftlich, which means ausreichend is it's not good. It's just the limit. Zweckmäßig means suitable. What is suitable? You can say a VW Golf, Volkswagen Golf is zweckmäßig. A Mercedes-Benz is zweckmäßig too, but there's a difference in it, you know. And wirtschaftlich means economic, and this means, in the meaning of the politicians and of the health insurance companies, it should be cheap. That's how we started, and the doctors became more satisfied with the situation because we were not any longer for ourselves. I knew the colleagues, and if I had a problem, no problem for me to ring him up and ask him, hey, I have a problem. Can you give me advice how I can solve it? You know?
What's doing this association? What do you have now?
We are still. It's like a club. Yeah, it's a club. The German word is Verein. This is a legal institution, but it's informal. We have a president, and we have a writer, and we have one who is responsible for the money. But the thing is, we have frequent meetings. We meet one time a month. We have several quality circles, and everyone who is member of the network is advised to join the meetings and to take part at least at 2 quality circles
per month.
The quality circles have usually they meet 4 times a year.
Okay.
But everybody or every member of the network is challenged to have to fulfill some duties. So because this creates quality. If I know what my colleague is doing, and if he knows what I'm doing, we find out the way between, and he will advise me hey, this is not correct. The guidelines say something different. And I say that I might say the guidelines are not fitting to that problem. Well, these are health organizations, these are doctors' organizations. The surgeons have their own guidelines, the internals have their own guidelines, and so on. Okay. But not everything what is written down in the guideline is really necessary and is really good. Yeah? Because, for example, if you say the patient situation might be different. An example: an 80-year-old farming man who is living up in the woods, and who suffers heart failure. From the guidelines, I might advise him you need hospital treatment, but he says no, I want to stay at home. So the problem is not to give him the correct medical treatment. The problem is how can I provide him a good medical care and save a good living for him.